Look down at your feet right now. Go ahead. Because what you are about to learn in the next few minutes could be one of the most important things you have ever heard. Most people have no idea that their feet are sending them urgent warning signals. Signals that could be telling them they have diabetes or that diabetes is coming. And by the time they find out, the damage has already been done. Do not let that be you. Stay with me. Hello and welcome back. If you are 50 years old or older, this video is for you. And even if you are younger and you have a parent, a sibling, or a close friend you are worried about, please stay because this information could change or even save a life. My name is Dr. Carter, and for over 3 decades I have worked with patients managing diabetes and its complications. And I can tell you this with complete honesty. The feet are one of the earliest and most reliable places the body gives us warning signs that something is wrong with blood sugar. Long before a diagnosis, long before a blood test comes back abnormal, the feet are already trying to tell you. The problem is, most people ignore those signs. They chalk it up to age, to being on their feet too long, to the wrong shoes. And by the time they pay attention, the damage has progressed in ways that are much harder to reverse. Today we are going to talk about 9 specific warning signs in your feet that could mean diabetes or pre-diabetes. I want you to look at your own feet as we go through each one. And if you recognize even 2 or 3 of these signs, please make an appointment with your doctor. Not next month, this week. Let us begin. Warning sign number 1. Numbness or tingling in the feet. This is one of the most common and most overlooked early signs of diabetes, and it is also one of the most important. When blood sugar stays elevated for too long, it begins to damage the nerves throughout the body. This is called diabetic peripheral neuropathy, and the feet and lower legs are almost always the first place it shows up. What does it feel like? Some people describe it as a pins and needles sensation, like the feeling you get when your foot falls asleep, except it does not go away. Others describe it as a buzzing sensation, or a feeling of wearing invisible socks when there are no socks on the feet at all. Some people feel a subtle burning that comes and goes. Here is why this is so dangerous. Numbness means you are losing the ability to feel pain in your feet, and pain is your body's alarm system. When that system starts to fail, small injuries go unnoticed. A tiny cut, a blister, a bruise. Without pain to alert you, that small injury can become infected. And in people with diabetes, infections in the feet can escalate very quickly into something life-threatening. If your feet tingle, buzz, or feel numb on a regular basis, that is not something to ignore. That is your nervous system sending you an urgent message. Warning sign number 2, burning or painful feet, especially at night. This may seem like the opposite of numbness, and in some ways it is. But both can happen at different stages of nerve damage from high blood sugar. Many people with early diabetic neuropathy experience a burning sensation in the feet that gets worse at night. When you lie down and the distractions of the day are gone, the burning becomes impossible to ignore. Some people describe it as walking on hot coals. Others say it feels like their feet are on fire from the inside. This happens because the nerves, as they begin to deteriorate from prolonged exposure to high blood sugar, send misfired pain signals to the brain. The nerves are not functioning correctly, so the brain interprets their confused signals as burning or intense discomfort. If you find yourself unable to sleep because your feet feel like they are burning, if you have to keep your feet uncovered at night because even the weight of a sheet feels uncomfortable, please take that seriously. That is a classic early warning sign that blood sugar may be damaging your nerves. Warning sign number 3, slow healing cuts, sores, or blisters. Let me ask you something. Have you ever had a small cut or sore on your foot that just would not heal? One that dragged on for weeks when it should have healed in days? In a healthy body, the healing process is efficient. White blood cells rush to the site of injury. New tissue forms. The wound closes. But in a body where blood sugar is elevated, that entire process is compromised. High blood sugar damages blood vessels, reducing circulation to the extremities, especially the feet. Less circulation means less oxygen and fewer of the nutrients the body needs to repair tissue. The immune response slows down. Bacteria thrive in high sugar environments, and what should have been a minor wound becomes a chronic non-healing ulcer. This is one of the most serious complications of uncontrolled diabetes. Diabetic foot ulcers are the leading cause of non-traumatic lower limb amputations in the United States, and almost all of them start as something small: a blister from a new shoe, a small cut from a nail, a crack in dry skin. If wounds on your feet are taking an unusually long time to heal, do not wait. See a doctor. Warning sign number 4. Dry, cracked skin on the feet and heels. Everyone gets dry skin from time to time, but the kind of severe, persistent dryness and cracking you see in people with uncontrolled blood sugar is different. It is deeper, more stubborn, and it tends to come back no matter how much lotion is applied. Here is why. The autonomic nervous system, the part of your nervous system that controls automatic functions like sweat production, is also affected by high blood sugar. Damaged autonomic nerves reduce the ability of the skin on the feet to produce natural moisture. The result is skin that becomes extremely dry, rough, and prone to cracking. Those cracks, especially on the heels, are called fissures, and they are not just cosmetic. Deep heel fissures can bleed, they can become infected, and in someone whose circulation is already compromised by diabetes, that infection can spread rapidly. If your heels are constantly cracked to the point of bleeding or pain, and no amount of moisturizing seems to keep it under control, that is worth a conversation with your doctor. Warning sign number 5. Changes in skin color on the feet or lower legs. Take a moment right now and look at your feet and ankles. What color are they? Are they the same shade as the rest of your leg? Or do you notice unusual discoloration? Diabetes affects circulation in very specific ways. When blood flow to the feet is reduced, the skin can take on a pale or bluish tone. In darker skin tones, this can sometimes appear as an ashiness or an unusual grayness. Some people develop a reddish or brownish discoloration around the ankles and lower legs, which can be a sign of blood pooling due to poor venous circulation, something that often goes hand in hand with diabetic vascular damage. Another skin change to watch for is a condition called diabetic dermopathy. This appears as light brown, scaly patches on the shins. They look a bit like age spots and are often dismissed as normal aging, but they are actually caused by changes in the small blood vessels that serve the skin. They are harmless on their own, but they are a reliable indicator that blood sugar has been elevated long enough to affect the blood vessels. Any unexplained color change in the feet or lower legs deserves medical attention. Warning sign number 6. Swelling in the feet and ankles. Swelling in the feet and ankles is common in older adults for many reasons. Standing too long, sitting too long on a plane or car ride, certain medications. But swelling that is persistent, that is present in the morning when you wake up, that leaves deep indentations when you press on it, that is a different story. In people with diabetes, swelling in the feet and ankles can indicate that the kidneys are being affected by high blood sugar. Diabetic nephropathy, or kidney damage from diabetes, causes the kidneys to lose their ability to filter properly. Fluid then builds up in the tissues of the lower body, particularly the feet, ankles, and lower legs. Swelling can also be a sign of poor circulation and damaged blood vessels that are allowing fluid to leak into surrounding tissue. If your feet and ankles are swollen regularly, if your shoes feel tight by midday even when they fit fine in the morning, if the swelling is accompanied by any of the other signs we are discussing today, please see your doctor and ask specifically about your kidney function and blood sugar levels. Warning sign number 7. Foot infections that keep coming back. Do you find yourself dealing with fungal infections like athlete's foot or toenail fungus again and again? Does it seem like no matter what you try, the infection comes back within a few weeks or months? Here is the connection most people never make. Fungi and bacteria thrive in high-sugar environments. When blood sugar is elevated, the sugar essentially feeds these organisms, making them harder to eliminate and far more likely to return. Repeated fungal infections of the feet and nails are a well-documented early warning sign of diabetes and prediabetes. The immune system, already suppressed by chronically high blood sugar, cannot fight these infections as effectively as it should. And the warm, moist environment between the toes makes the feet particularly vulnerable. Toenail fungus in people with diabetes deserves special attention. It causes the nail to thicken, become brittle, and lift away from the nail bed. That lifting creates a perfect entry point for bacteria. In a person with poor circulation and compromised immunity, that can lead to a serious infection very quickly. If you are repeatedly treating foot or nail infections that keep coming back, do not just treat the infection. Find out why your body is struggling to fight it off. Warning sign number 8. Changes in the shape of the feet or toes. This one surprises many people, but diabetes can actually change the physical shape of the foot over time. One of the most significant conditions is called Charcot foot, pronounced Charcot foot. It is a serious complication of diabetic neuropathy, where the bones in the foot weaken and can fracture and shift without the person feeling any pain. Because the nerve damage has taken away the ability to feel, the person keeps walking on an injured foot, making the damage worse with every step. The foot gradually becomes deformed. The arch collapses. The foot takes on a rounded rocker bottom appearance, and by the time it is noticed, significant structural damage has already occurred. On a less severe but still important note, nerve damage from diabetes also affects the small muscles in the foot that keep the toes in proper alignment. When these muscles weaken, the toes can begin to curl under, forming what is called hammer toe or claw toe. This changes the pressure points on the foot, leading to calluses and pressure sores in unusual places. If you notice that your feet look different than they used to, that your toes are curling, that your arch has dropped, that one foot looks swollen or misshapen compared to the other, get it evaluated. Do not assume it is just arthritis or aging. Warning sign number 9, hair loss on the feet and lower legs. This one is perhaps the least well known, but it is a telling sign that blood flow to the extremities has been compromised. Look at your feet and lower legs. Is there hair on them? In men especially, some hair growth on the feet and lower legs is normal. But if you notice that the hair has thinned significantly or disappeared entirely from the toes, the top of the feet, and the lower legs, that is a sign that circulation is poor. Hair follicles need a good blood supply to function. When the blood vessels that serve the lower extremities are damaged by chronically high blood sugar, the hair follicles stop receiving adequate nourishment. Hair growth slows. Eventually it stops, and the skin in that area may also begin to look shiny and thin. This kind of hair loss on the feet and legs is a classic sign of peripheral artery disease, which is extremely common in people with diabetes. It means the arteries supplying the legs and feet have narrowed significantly, and narrowed arteries mean reduced healing, increased risk of infection, and a much higher risk of serious complications. If you have noticed significant hair loss on your feet and lower legs, especially if combined with any other signs from today's list, please discuss this with your doctor and ask about peripheral artery disease. Now let me bring everything together for you because I want you to leave this video equipped and empowered, not frightened. The 9 warning signs we covered today are numbness or tingling in the feet, burning or painful feet, especially at night, slow healing cuts or sores, dry and deeply cracked skin, unusual changes in skin color, persistent swelling in the feet and ankles, recurring foot or nail infections, changes in the shape of the feet or toes, and hair loss on the feet and lower legs. None of these signs on their own is a diagnosis. They are signals. They are your body's way of asking for attention. And the good news is this: when diabetes or prediabetes is caught early, real change is possible. Blood sugar can be managed. Nerve damage can be slowed or stopped. Circulation can be improved. Many people have reversed prediabetes entirely through diet, exercise, and lifestyle changes. But none of that is possible if you wait. The longer blood sugar stays elevated without treatment, the more damage accumulates. Damage that is often irreversible. So here is what I want you to do after watching this video. Check your feet today. Look at them carefully. Feel them. Take note of anything that seems unusual. If you recognize 2 or more of the signs we talked about today, call your doctor this week and ask for a fasting blood sugar test and an HbA1c test. Those 2 simple blood tests can tell you a great deal about what your blood sugar has been doing over time. And while you are waiting for that appointment, take simple steps to support your blood sugar now. Reduce sugary drinks and processed carbohydrates. Walk for 20 to 30 minutes each day. Stay hydrated. Get enough sleep. These are not dramatic changes, but they matter more than most people realize. If you are already living with diabetes, please make foot care a daily habit. Wash and dry your feet thoroughly every day. Inspect them carefully, including between the toes. Moisturize the heels and the tops of the feet, but not between the toes. Wear properly fitting shoes. Never walk barefoot, even indoors. And see a podiatrist, a foot doctor, regularly as part of your diabetes care team. Your feet are not just for walking. They are one of the most sensitive indicators of what is happening inside your body. Pay attention to what they are telling you. If this video helped you today, please share it with someone you care about. A family member, a friend, someone who might be ignoring signs they should not be ignoring. You may be doing them one of the greatest favors of their life. And if you have not subscribed to this channel yet, please do. We are here every week with honest, clear, practical health information, designed specifically for adults who want to live well for a long time. Take care of your feet, take care of your health, and I will see you in the next video.